Hey guys, how are you? So guys, our today's topic is about the typhoid fever. In this lecture we will discuss about the definition of the typhoid fever and its causes, symptoms and its diagnosis and about its treatment. So guys, before we start our lecture, if you guys are new to my channel, then please subscribe my channel and click the bell icon. So guys, first we will discuss about its definition, okay? That what is its correct definition. So guys, before knowing about its definition, we must know one little thing about the typhoid fever, which is very important. That typhoid fever is an enteric fever, okay? Enteric fever, okay? So guys, this thing is very important to know that what is an enteric fever. So guys, what is your concept about the enteric fever? So let me tell you that enteric fever means, like, first we must know what is the meaning of enteric. So it is that anything related to intestine, okay? Anything which is related to the intestine is known as enteric fever, okay? Mainly the small intestine, because most of the diseases and most of the things are related to small intestine, but anything which is related to intestine is known as enteric. We call it enteric in the medical terms. So what could be the enteric fever? The fever which is caused due to some problem in the intestines, okay? Some problem in the intestine, okay? What kind of problem? What will be an enteric fever? What will be its clinical manifestation? Let me tell you. First is the fever, because it is an enteric fever, so the fever is must. What is the other thing? Headache. What is the third thing? Nausea, vomiting, and the last is abdominal pain, okay? So these four are the main characteristics for any fever to be enteric, okay? If someone is having these 5 characteristics, 1 2 3 4 5, someone has these 5 characteristics, then it means that he is having an enteric fever. So then why, but in this is the lecture about typhoid fever, so why we are talking about the enteric fever? Because typhoid is also an enteric fever, okay? It is a fever of the intestine as well. Anything which is in the intestine and it has these symptoms, fever, headache, nausea, vomiting, then it is an enteric fever. So what is the, why we are discussing a typhoid fever as separate? Because it has some different things. Like, the correct definition of typhoid is enteric fever caused by salmonellatyphi. Salmonellatyphi is a bacteria and it causes typhoid fever. So any enteric fever which is caused by salmonellatyphi is known as typhoid. So the definition of typhoid is enteric fever caused by salmonellatyphi, okay? So now we know that salmonellatyphi is the main thing which is causing the typhoid, but how it is causing it? Okay, we must know how it is caused. Like, salmonellatyphi will not just go into everyone, and he likes to go into every person and he likes to cause diseases there. There must be something which causes it. There must be some kind of phenomena which will take this bacteria inside, like many things happen. So let us discuss its causes, okay? Causes. So how it is caused? How salmonellatyphi will get inside? By consumption consumption of contaminated food. Contaminated by what? Contaminated by stool. Okay, stool containing what? Salmonella, or just write S. typhi. Okay, S. typhi. So and consumption of contaminated food, what is that contamination? It is not a grass or like urine, nothing. Stool containing salmonella typhi. Okay, so how is it possible that a stool is containing salmonella typhi? Because the main thing is that salmonella typhi is present where? Is normally it is the reservoir of human. It is present in the stool of human being, and in the human being stool there, in human it is present in the stool. Okay, and how it goes inside someone, how it will cause someone? It will be maybe due to someone not washing his hands and cooking the food, or maybe the water, there's no clear drainage system of the water, and then it will go into the water and someone will eat or drink food or water which is contaminated. So then what will happen? The food and or water will get contaminated by stool. What is the next thing that will happen? Someone will ingest this food, and this food is ingested, eaten or ingested, and then what will happen? The food will go where? The mainstay, the intestine. Okay, so this is how it is happening. This is the way it is caused, how it goes into the intestine. So this is just the right way and the right pathway of it's going into the intestine. But now how this bacteria, after going it inside, now we know that what is the cause of it going inside the human, but now how it is going to do some changes inside the human body, human intestine. What kind of changes it is going to do inside the intestine? So let's discuss it in its pathophysiology. Okay, in its pathogenesis. Okay, the pathogenesis, we know the normal physiology. If you want a lecture on normal physiology of intestine, then you can just comment in the comment section. So where were we? That we were at consumption of what? Contaminated food, and obviously contaminated by what? S. typhi. Stool containing S. salmonella typhi. And where this contaminated food is gonna go? Definitely the food always go into the intestine. Everyone knows intestine. So after that, where does it will go to cause typhoid? What is, once it goes into the intestine, the salmonella typhi would like to go where? Into intestinal mucosal epithelium. So now the salmonella typhi would like to go into the intestinal mucosal epithelium so that it can go and replicate there. So how is it gonna go inside? Because there is no special welcome to the salmonella typhi, so it will go by transcytosis. It will go by transcytosis inside the intestinal mucosal epithelium. From there, when it goes inside there, what it will start? It will start a dangerous process, which is the replication. It will start its replication. Okay, and it will start replication inside three things. What are those three things? macrophages of peyerspatch. Okay, macrophages of peyerspatch, mesenteric lymph nodes, and the third place is spleen. So it will start its replication in 3 places. Okay, in 3 places. And what is the peyerspatch? Let me tell you, if you guys don't know, peyerspatch is the immune system of the intestine. Okay, immune system of intestine, small intestine. And everyone knows mesenteric intestine, yeah, spelling mistake. Everyone knows mesenteric lymph nodes, the lymph nodes which is of the stomach and GIT tracts, and everyone knows about the spleen as well. So the it will replicate in the macrophages, the immune system, inside the immune system, which is peyerspatch. It has macrophages, and it will replicate inside that peyerspatch and in mesenteric lymph nodes and into the spleen. Okay, so now what is happening? The replication has started. Okay, once it goes inside and replication has started. So what is going to happen after some time? After 12 to 48 hours, 12 to 48 hours is its incubation period. After 12 to 48 hours it will start producing symptoms. Okay, symptoms, because it will start doing damage. Okay, so what kind of symptoms it is going to produce after 12 to 48 hours? It will first produce headache, then it will produce fever. One is headache, the other is the fever, the third is abdominal pain, and the last is constipation. So what it is doing after its incubation period, for we can say, if it is inside the body for 12 to 48 hours, this is known as incubation period, the time which bacteria take to produce the symptoms. Okay, so its incubation period is 12 to 48 hours. So after this incubation period, it will start producing headache, fever, abdominal pain, and constipation. And what kind of fever it is going to produce? The type of fever which is increasing day by day. Okay, we can just say, I was thinking of saying every day, but day by day is a better word. Okay, so the fever will be starting to increase day by day. And one more thing is that these symptoms is only when after the consumption of food, remember that, and the incubation period will start, and after 12 to 48 hours the incubation period will be done, and then headache, fever, abdominal pain, and constipation will occur, and the fever is of that type which is increasing day by day. So this will start happening, and you have to start to treat him, because now he has salmonellatyphi, but you have to diagnose it perfectly as well. So now there's one more thing. For example, this bacteria is living inside, and no one is treating. He is just taking paracetamol and not doing anything. He is thinking it is just a normal fever. So what will happen after 2 weeks? For example, it's already 2 weeks for this bacteria to be inside. What will happen? Then bacteremia will occur. Okay, bacteremia means what? Bacteremia means spread of bacteria everywhere. Quick spread of bacteria. So quick spread of bacteria will start, and he will be developing some symptoms within 2 to 3 weeks. Some more changes will happen in the body. After 12 to 48 hours, these changes have started in his body after the ingestion of salmonellatyphi. Then if he's and till 2 weeks only these symptoms will remain. But suddenly if the bacteremia will occur, what will happen? Some more symptoms will come. Like first one is splenomegaly. Splenomegaly, enlargement of spleen, raw spot, pink macules, pink spots on the chest normally, okay, chest, stomach or chest, pink spots on chest. Let me write, because this is very common after 2 weeks. Pink spots on chest or abdomen. Okay, so you have seen too many different things are happening. Splenomegaly is dangerous because bacteria have divided a lot inside the spleen, as we discussed here. And what else is gonna occur? Bradycardia, because he will start having some weakness. And leucopenia. Okay, but we are not done here. More symptoms will come. Diarrhea, more complication will occur because he is not treating it. It's been 2 weeks. And what else? Gallstones, vomiting, gallstone, because it will be staying in the gallbladder mainly, and from the gallbladder it will come into the stool, and then this cycle will continue again. Flu-like symptoms, and meningitis. Okay, no, not okay, it's not done yet. Seizures, because it will start to do central nervous system damage as well. Meningitis, seizures. You must be thinking I am joking that this it will cause so many complications after bacteremia, but it is real. You can find it in the books. So this shows that how dangerous it is. Endocarditis, cardiovascular damage has started. Myocarditis and cholecystitis. So when these symptoms are occurring, 2 to 3 weeks. So guys, this shows to us what? It shows that you have to treat typhoid within 2 weeks after. When someone feels he is having fever, he will have headache, fever, abdominal pain, constipation, and it's been a week, then he must come to the doctor for its checkup. And when someone will come to you, he will say, I had consumption of food maybe 5 days ago, and from when I wake up next morning I was having fever. Then what does it mean? The problem is due to the consumption of the food, and he will have headache, abdominal pain, and constipation. Then this must make you think that it is about typhoid, because it is the symptoms of enteric fever. So you must check it, is it typhoid or not. So for it to be typhoid, you must find salmonellatyphi as well, so you can give the treatment of typhoid. So we must treat it quickly within 2 weeks, otherwise bacteremia will occur. So you can see that how dangerous it is. It is going to cause so many big problems. Okay, so let's try to diagnose it quickly. Once you have find someone come to you, he has headache, fever, abdominal pain, constipation, and his fever is increasing day by day, and it was caused due to salmonellatyphi. And not salmonellatyphi, because of consumption of food. What are you gonna do? Let's start our diagnosis. You're gonna do what? You're gonna send it. If you find that he has come before 2 weeks, just do what? Blood culture, because blood culture will be positive before 2 weeks, or you can say at early stage, and the stool culture will be negative at early stage. But if he comes after 2 weeks, then there is gonna be a funny thing which will happen. After 2 weeks you will do blood culture, then the blood culture will be what? Blood culture will be negative. And if you will do stool culture, then it is gonna be positive. So what does it shows? That if a person comes after 2 weeks after bacteremia has occurred, then you must do stool culture, but you can also do blood culture, both as well. But this will you can find this by the history, that if a person has fever for 1 week, then he is having early stage, so you can just do blood culture. Okay, and what you will find in the blood culture, salmonellatyphi. So once you have find salmonellatyphi, what are you going to do? It's easy now, just do the easy treatment. Diagnosing is a little difficult maybe, but I guess after this video it will not be difficult for you. What are you gonna do? First line treatment. Once you have diagnosed salmonellatyphi mainly due to blood culture, what you're gonna do? What is the first line treatment? Ciprofloxacin. Just give him ciprofloxacin plus paracetamol BD for how much time? For 2 weeks. Okay, but it happens that person has resistance to ciprofloxacin, so if the first line fails, then you will do second line. Okay, second line is what? You will change ciprofloxacin. Paracetamol is same for the fever, you will change it to azithromycin, same BD 2 weeks. Okay, and even sometime it happens that second line also fail, so what you guys are going to do? You're gonna go to third line. Okay, and what is the third line? Injection of ceftriaxone, very powerful ceftriaxone injection. This will definitely kill it. Okay, and this is also for 2 weeks, remember. So how you are going to do this? For example, you give them ciprofloxacin for how much time? For you maybe 3 to 4 days. You will tell him come after 3 to 4 days, and when he comes back he says I'm not having anything any better, I'm not feeling any better, no feeling better, then what you're gonna do? You will change it, because if someone is not resistant to ciprofloxacin, he will start feeling better within 3 to 4 days. So if he is not feeling better, then you will change it to azithromycin. And even if he is not feeling well after 3 to 4 days by azithromycin, then the injection of ceftriaxone, and it will definitely do it. Okay, and for example, someone comes to you, this last criteria, maybe after 4 weeks or 5 weeks, 4 or 5 weeks, and you find that his stomach is completely filled by this, replication has gone too far. So then you guys will have to perform surgery, cholecystectomy. Okay, so then you will have to perform surgery, but it is not for M.B.B.S, it is maybe for the surgeons. So if you are a surgeon, then you can perform cholecystectomy. Okay, so this was all about it. I hope I have explained everything in this typhoid fever, pathogenesis as well, symptoms, diagnosis, treatment, and there is nothing more that you guys want to know, because everything is being clear. And about its vaccine as well, I will tell you one more thing, that its vaccine is not recommended for everyone. It is only recommended for the travelers, because its vaccine is only will provide 50 to 60% protection. So its vaccine is not being used so much for everyone. Okay, so it is known as Y vaccine, Y typhoid vaccine, but it is not being used, and no questions also come from this in the exam. So this was all that an M.B.B.S student must know, and I have explained everything inside this. So guys, if you like my video, then please subscribe my channel and click the bell icon. And if you guys also want some of these amazing videos on some other topics, then you can just comment in the comment section and I will make a video for you. Okay, so guys, thank you so much. Bye bye, see you.